Dr. Will and Dr. Eric are going to talk about some of the collaborations they're doing in cancer care and research. And also, we get the opportunity to hear about the history of the Global Health Catalyst Summit and why it is important in bridging the healthcare disparities in the world.
So, the Global Health Catalyst Summit is just one part of a program at Harvard that we started, the Global Health Catalyst, which is really a program that bridges disparities. So it's about bringing people from developing countries here and then finding collaborators here. The reason for that, because if you are born with cancer, somewhere in Mozambique or Cameroon or Nigeria, you may not have access to care. If you are born with cancer on the street down Longwood Avenue right here at Harvard Medical School, you have so many options. You have so many options. And so, but how can you, because of no fault of your own, where you're born, you don't decide where you're born. So that's an injustice that we've thought, you have to bridge that disparity. And so to do that, the best way to close that is to kind of collaborate. So that's what, so this is funded by Harvard, several institutions here at Harvard, and the goal is to kind of create collaborations to eliminate disparities. So, and it also involves, a very unique part of it involves engaging the diaspora. So you may have heard about the whole idea of brain drain. You and I are here because we have left, there's nothing that can happen back home because of the brain drain. But with, somebody mentioned that today during the talk, with globalization and with information and communication technologies, you can sit here and you can do stuff, 4,000 miles away. And so we've been able to find a platform here where, we can still, like diaspora, contribute back in Africa and make a big difference. And so I can tell you about a number of things that we're doing. But Dr. Eric, actually, we had a phone call the other day, and it was very interesting that we said we had the CEO of a multi-million-dollar company here who is from Cameroon. And then we had the top scientists and two scientists from Harvard and Baylor, from Cameroon, talking about how they can work together to make an impact back in Africa. Okay, so that's the brain power of Africa, literally here, making the U.S. economy grow, healing patients, doing science here that's benefiting patients here. But now we're really looking at how we can collaborate to work back in Africa. I thought that was really powerful. And he should talk a little bit about the project that we're doing, so I don't take up all the time. But I'm very excited about, that's a unique thing about this. There's no conference where you have, the diaspora elevated to the point where, they're actually looking at how they can give back in healthcare, which affects all of us. So that's a unique thing about the conference. The last thing I would say is that we also really leverage information and communication technologies, where we've built this cancer center in the cloud, where it doesn't matter where you are in the world. You have a computer, you can just log on there, and you can get consultation, you can get training, you can even do what we're just talking about, doing a clinical trial. Oxford, Harvard, and African institutions, which are all controlled remotely. And so that's something that we're very excited about, using information and communication technologies to bridge the geographic barriers.
And Dr. Eric, tell us about the significance of the Global Health Catalyst Summit and how you fit into all of this.
Yeah, so, this is my fourth Global Health Catalyst Summit. And over the years, I know Will and I have bounced a few ideas between us, but what really struck us this time, and which we really want to go into, is phytomedicine. All of us growing up in Africa, when we were sick, most of the time is that our parents would go behind the house, or they contact somebody, they will get some leaves, they cook them, and we'll take those out, and we'll feel better. Yeah, so what we really, in the scope of the Global Health Catalyst, what we want to do is that we know that these plants, they have a lot of good activity, but there's no scientific proof that you can get those into the mainstream pharmaceuticals or get them through regulation so that they can be approved for use in the bedside. So the work we're trying to do this time is that we want to, as Will has done in the other areas, he's trying to bring in both scientists and industry who are going to work together. And as he said, we had a phone call with one of our friends who is a He has his industry. Both of us are in academia. So we're going to put together, harness our resources.
Right.
And then we have already have some compounds that are interesting. And we're going to work together to push them through the pipeline together.
That's interesting. I had a conversation with the ambassador for food security, Pan-African Parliament, and she was talking about we were talking about the vital medicine. And it's interesting that, again, you bring up this conversation because of when we look at healthcare in Africa, the biggest percentage of primary healthcare is ethnomedicine.
Absolutely. And we discussed that with the ambassadors. We're actually thinking of putting out an op-ed, basically, or a statement coming out of the ambassadors who were sitting here today, and the whole idea that can actually be a way to stimulate not just healthcare, but economic development, right? So we've seen that, like with the project that we talked about here, if you create that kind of thing, you're going to give those women jobs. Right. You're going to give men jobs. You're going to give people jobs there. And then you also develop remedies that are accessible from the local population, which means that it's not high, expensive drugs that are made here in the United States, and you have to go on begging for them to make discounts. You actually develop that from there and actually can bring it to the United States and sell it here, right? Yeah. So that with the phytomedicines, but also creating economic development. So that's something that, like you mentioned, we really need to work with government who can create those. That's a very good idea. That's what basically I'm saying. And these ambassadors are very enthusiastic about that. And we hope that, actually the follow-up of this summit is that we are going to be traveling to these countries, and they want to facilitate that. And bringing the power of science and industry, bringing that there with healthcare providers, to kind of find ways where we can actually stimulate healthcare and development there that's accessible.
This is exciting because last year I was actually a speaker at the Global Health, the Wakanda panel. Yeah. I talked about using ethnomedicine to bridge the healthcare gap, the indigenous knowledge, because we were raised on indigenous knowledge. Our healthcare was, like you mentioned, getting herbs from the back of the house to, And one of the example, actually, in my presentation was based on one picture, one image. It was of my grandmother sitting outside on a mat, which was made out of palm leaves. And beside her, or behind her, was a plant we call omjaja. I think it's Omnissimum. I forget the scientific, but we still use it for tummy aches. If you had a tummy ache, just get omjaja, make a cup of tea with mojaja, and drink, and you have no gas in your tummy. So my presentation was about just going back to those indigenous ways and then just research them to work out, identify the dosages, the right dosages, because that's the conversation that, maybe the dosage is wrong. And recently, I was mentioning it to somebody else. I was in Uganda, and there was an organization, I think it was Theta Uganda, that was having a project with the herbalists. So the medical doctors would work with the herbalists so that medical doctors would diagnose, in a professional way, and then they would ask the herbalists to administer their solutions or whatever they did, and then the doctors would observe the patients in a room. They wouldn't leave the facility just not to distort the research. And it was amazing. And I was thinking to myself, why can't the diaspora rise up and engage in that kind of research and collaboration to help our people? They cannot afford drugs. They are dying. So this is exciting. I can't tell you how excited I am.
Right.
Do you have anything to say?
Yeah, I think Will already made an allusion to this, that one of the drivers that really drives us is for us to be able to bring these remedies in a much purer form at an affordable cost to our people. And one other thing that we have noticed, which is really what also drives us, is the intellectual property. Oh, yeah. So sometimes they use all of these remedies. Then someone from the West comes with the knowledge and then takes away everything. I think what Global Health Catalyst can do is that can act as an observer or somebody who can make sure that all the resources or all the gains that come out of any study, the locals, from where the plant originated or from where the knowledge originated, they have their fair share of the profits and the intellectual property that comes out of it.
I couldn't agree more. I couldn't agree more. I just said the same thing to the ambassador over there because he was telling me that, very excited that he has a plant. He knows a plant. So you are really, I think you are the cutting edge. If that was your talk last year, you were ahead of us.
You know, and it goes beyond.
Maybe we should credit you for.
Absolutely, no, that's fantastic.
No, it was, and I still have. If there was any recording, you'll have the presentation. I have the PowerPoint. You can see.
I know exactly what you just said.
Yeah,
I basically said, one of the key things is to make sure that if you get a plant from Uganda, right, and we did the studies, we developed the evidence base, right, any intellectual property or patent, they have to get, a reward from that as well. Those communities have to get a reward, so that's, and what we could do, the idea about talking to governments is that just make sure that the government, if we're working with governments, that they create that, they facilitate that. So it's not that we're doing it and then some government official takes it and,
It's interesting you say that because one of the things I was chatting about with the ambassador, I'm like, be honest, I've heard that every medicinal plant has been patented by the Western world. Is that the truth? And
Actually, just 13. I think 13%. I have some really good number. Only 13% of medicinal plants are actually known, right? A huge amount of it. I can tell you. We actually tomorrow you'll see, if you are here, you see we have an exhibit. He gave the talk last year about that. So we've been developing this plant that was discovered in Cameroon, that bleeds, literally. So the title of the presentation is Blood from Plants. And then what we started doing and looking at that was, this plant has these remarkable properties. And then the Smithsonian Institute tried to find out what the species was. And they still haven't found it. Right? So I'm just saying that to say there are many of these plants that people don't even know yet exist.
Huge
So
untapped potential. It's a huge untapped potential.
here's my request to appeal to everyone out there in Africa. If you're a diaspora member, if you know of any plant, please reach out to us. You can reach out to me at africa2u.vivian@gmail.com. We'll get back in touch with you, with the doctors, to talk about the medicinal plant that you know, and we'll take it from there. And if you have grandparents, please take videos of them talking about the medicine they did, even if it's your local language. We'll get interpreters, and then we can archive that information, because we're going to lose it if we don't archive it right now. And then when at some point, we'll give it to the professional researchers like these doctors who are knowledgeable about these things, and then we will save our continent.
and the person will get value from it. So they will also, the people, if you do that, you're going to get benefit. So we're not going to do that and then take away your knowledge. That's very important.
So this is the collaboration that we're talking about. So every one of us can collaborate. It's a win-win, and this is what the Global Health Catalyst is about. It's not an elitist program. It is a program for meeting the needs of our communities, and each of us has a role to play. If you don't know a medicinal plant, spread the word. That is helpful. This is exciting, and we appreciate each and every one of you. You're contributing immensely to humankind, and not just, and of course, you're proud sons and sons of Africa. We can't be even more prouder. And
But I should say that, we need people like you. You have all these great things. If the people don't know about it, so if the media is very important to educate the public about these things. If you don't do that, it used to be that the first conference organized here, just cancer specialists here and I talking to each other, and we can have some impact, don't get me wrong. But it's not the same when these policymakers, ambassadors, ministers come and they actually get educated and they're going to shape policy. Right. So tonight you're actually going to hear from Karen Bass, and she's the chair of the U.S. Congress House for Global Health and Foreign Policy. And what she's going to be talking about is, PEPFAR was the most successful, biggest foreign policy that any country, United States, has given. Right. It saved millions of lives, hundreds of millions in Africa. right, for non-communicable diseases. But now people are living longer. Guess what's happening? If you live longer from HIV/AIDS, you get cancer. Okay, you get non-communicable diseases. And so now the thing is you need to get these policymakers now and also invest in that. And so if you don't talk to them, there's not going to be any policy, you know. And so we'll have impact, but it's limited.
You're talking about collaborators in government. How does the U.S. fit into this whole picture? But it's interesting to know that there's someone from Congress, because at the end of the day, they are the decision makers when it comes to the budget and the allocation.
Congress here on Capitol Hill on this. Like, I mean, that's part of the education process, right? So you have to educate them. And I think some young 3 high school students were here from a local high school here, and they were trying to engage the government leaders. You know, one of the answers they gave that was very important was, you know, mobilize, engage your Congress people, educate, because, I mean, as you shape U.S. policy, foreign policy, which is America's very powerful thing, is the soft power that America has abroad, right? So if you can shape that, you know, to invest in healthcare and the things that are coming up now and emerging like cancer, that's a big win, right?
Yeah, but when much of the U.S. policy is centered mostly on business, trade, and investment.
And that's one example, right? Like you said.
Yeah, it is. But then it will be interesting to learn about how you're working with the U.S. government to integrate some of your work into the U.S. policy.
Yeah, absolutely. I can tell you. You want to?
Yeah, just final word before you. So we are launching the Phyto Medicine program here on Sunday. And it's after we'll do the launch, there will be no turning back. You're just going to go ahead, as you already started with soliciting for people to bring in whatever ideas they have. Once it's launched, it's going to take off. And
so I'm ahead of the.
We have a $9 million commitment to it. So
excellent.
Take off. Yeah. Absolutely.
Well, I'm so proud of you all, and I look forward to continued partnership. We have to spread the word. We will, each of us, again, it's a reminder, we each have a role to play. Do not underestimate your role. Every commitment works, whether it's spreading the word, whether it's talking to your grandparents about medicinal plants, whether it's visiting the San community where the San people in Southern Africa know all kinds of plant species. We're in this together. Join the Global Health Catalyst team, and let's make a difference. Thank you, gentlemen. Thank you. All right, it was nice to meet you.
Thank you for the great work.
You're welcome. Bye.